Welcome back to Healthwise. With us is Dr. Chancellor Donald with the Louisiana Oncology Associates. Doc, can you tell us a little bit, first of all, what is oncology for our audience?
Sure. Oncology is the branch of medicine that deals with malignancies. Whenever we have an abnormal growth, it could be benign or it could be malignant. Malignant meaning that it tends to invade other structures and cause problems or possibly move to other parts of the body. There are several branches of oncology. There are surgical oncologists who perform surgeries and they specialize in removing these tumors. There's radiation oncologists who use high energy beams to essentially kill the cancer. And then also there are medical oncologists, which is the type of medicine I practice, in which we use chemotherapy and other agents in trying to grow, shrink, and for a few subset of cancers, cure it.
Okay. All right, Doc. Well, let's talk about that then. What kinds of cancer can you use medical oncology? What exactly?
Sure. Most cancers, if we're able to perform surgery, if it's a localized cancer, that's the preferred method of treatment. Once that cancer has spread to either lymph nodes, which are little glands that are around several structures in our bodies, or if they've moved to other distant places, a lot of times we use these chemotherapy drugs in order to either shrink it or eradicate it. There are a few cancers that we can use chemotherapy to purely eliminate, such as testicular cancer, but the vast majority of cancer, we use surgery in order to remove it from the body. And we may give chemotherapy in an adjuvant form, which means that the surgery has been performed, there's no signs of the cancer left, but we're giving chemotherapy to prevent or decrease the chances of recurrence. In some instances, we give it in a neoadjuvant way, meaning that we give the chemotherapy up front before the surgery in order to shrink it as much as possible, and then perform the surgery. And then lastly, we do chemotherapy in the palliative setting, meaning that the chances of a cure or the chances of totally eradicating the cancer from the body is extremely small, but we're hoping to shrink the tumor enough to decrease symptoms and hopefully prolong the life of the patient.
Okay, so if you shrink the cancer with this medicine, is that basically what we're talking about when someone goes into remission, or is that's what you're hoping anyway? That
yes, there are certain terms such as cure or remission that a lot of times you hear thrown around. Oftentimes what we want to do is to put a patient in a position where they have either responsive or stable disease. Technically, if we still see the cancer, that's not considered a cure. However, there are several patients who may have had enough shrinkage of that tumor that it's not causing any problems, and the chemotherapy is causing it not to grow anymore. And we consider that successful as well, especially in the setting of prolonging life.
Okay. What, you know, a lot of people, we hear horror stories, and I call it horror stories, but wives' tales. You know, you hear, oh, chemotherapy, you know, you're going to get so sick, you're going to be like wishing you're dead, and, you know, all that stuff. Let's shed a little light on that and tell the audience what exactly, you know, whether that's true or not, you know.
Well, fortunately, we have come a long way with chemotherapy. You do hear horror stories about being sick and not being able to eat and being weak. Actually, now we have enough supportive means of helping patients while they're getting chemotherapy that often they don't experience these side effects. One of the main and most dreaded side effects of chemotherapy is nausea and vomiting produced by the agents. What we do now, we give a lot of antiemetic or a lot of drugs that decrease the incidence of nausea and vomiting before the chemotherapy is even given. And that allows us to have our patients get the chemotherapy with little to no nausea or vomiting. Now, we still provide medicines often for the patients to have at home in case they do get these side effects. But that's the main thing that a lot of people dread. They see someone who's bald, they see someone who is thin, that is weak, and also vomiting. A lot of times that's not the case. As far as other horror stories, I like to tell our patients that often when you hear someone describe cancer, when you hear someone talk about their treatments, 90% of the time it likely doesn't apply to you. The reason I say this, not only do we have different types of cancer, lung cancer, colon cancer, pancreatic cancer, even within those types, such as lung cancer, there are different subtypes of it. There's small cell lung cancer, which is different than non-small cell lung cancer. The treatments are different, not only based on the type, but also the stage. When we talk about the stage of cancer, we're talking about how involved it is. We refer to the size of it, if it's involving other glands or other lymph nodes around that structure, or if it's spread to different parts of the body. Depending on the stage of the same type of cancer and the same subtype of cancer, the chemotherapy agents may be different. Okay. Additionally, if someone has liver issues, kidney issues, advanced age, or other comorbid conditions, that changes the chemotherapy we use. So often when you hear people talk about the things that their cousins may have gone through or close friends have gone through, it's likely that won't even apply to that patient.
Okay. And we're going to get a little bit more after we come from our sponsors, but I would just want to touch a little bit also on for the patients, exactly, what is cancer? Because when we talk about the medicine, I guess we want to touch a little bit without getting too technical on how the medicine shrink the actual tumor or the growth or malignancy or whatever, whether it's benign. So we're going to talk more on that after we have this brief message from our sponsors. So we'll come back after this.